Now that you know how complex the provision of long-term medical care as well as support for activities of daily living and other services is, we have to look at how it gets paid for. As you can see from this chart from the Kaiser Foundation, Medicaid is the largest source of financing for long-term care for these patients at 40% of the total bill. Next, coming up is Medicare for post-acute care. And Medicare, as you have been learning, will only pay for long-term care under certain circumstances. And that is almost exactly matched by patients having to pay out of pocket. Then you have a drop down to 9% of patients who actually have long-term care insurance paying for these services. And then you have the last 3 to 6% of other methodologies paying for these services. It is also at the same time important to look at the projection of who may need care, not only right now, but as we move into the future. And the reason this is very important at this moment is because the percentage of the population that is getting into that 65 and over age range is getting larger and larger as baby boomers, and I'm sure you've heard this before, the largest percentage of the total population age group are moving up into this, all right, for lack of a better term, we're going to call it senior age group, okay? But remember that a lot of this has to do with age and the fact that mere number of years deteriorates the body and the bodily function systems. So it's also important that we look at the fact that the money needed today to take care of our senior population as they need it will increase as this sector of the population increases. The good news is that this population tends to be healthier than those of the same age range from generations before. And then to countermand that, they're also living longer because they are healthier, which means, yeah, exactly. If you have any questions, I'm sure there are 3 other people who have the exact same question, so please don't hesitate to ask your instructor.